Hi, welcome everybody. Thank you for joining us. I know we still have attendees joining in. If you are here to talk about navigating mental health, you're in the right place. We welcome you. So, some housekeeping items. I'll put this in the chat as well. Q&A and chat are totally open for you. Q&A are questions that we'll be reading because we'll have some time for questions at the end, and also the chat for any of your comments or just thoughts that you want to share. Please feel free to use the reaction button as well. We like to see engagement in that way. And if you have any questions, let me or Alyssa Archer, who's also on the call, know behind the scenes. But Kate, take it away.
Thanks, Megan. So welcome everyone. Thanks for celebrating Mental Health Awareness Month by joining today's session about navigating mental health. And today, so I'm Kate Fisher. I lead the It's Okay campaign. I will be hosting, and with me today are two guests who have been really important to the development of our mental health campaign at Cummins. And I'm going to read because we're talking about mental health and not memory health, and I have a terrible memory. So we have Michael Landsberg. So if you have been on any of our webcasts in the past year and a half, you may have met Michael before, but Michael has joined us both as a guest and as a host. He's from our neighbor in Canada, and he is the former host of TSN's talk show Off the Record, which he hosted for 18 seasons. And he's also, and very critically, the founder of the charity #SickNotWeak. And he's ambassador for Bell Let's Talk, which is a Canadian establishment that's dedicated to destigmatizing mental health for Canadians. He has a documentary, Darkness and Hope, that was nominated for a Canadian Screen Award, and for which he personally received that organization's humanitarian award. So welcome, Michael. And so your bio is just as impressive as Dr. Joe's.
Well, no, definitely not. But I will say, thank you for having me. And it's one of the joys of my mental health advocacy has been working with you guys. I love the fact that I get to be here sharing this experience. So thank you.
You're welcome. We're going to talk more about that in just a minute. We also have Dr. Joe Grasso, who is Vice President of Workforce Transformation at Lyra Health. For those of you who don't know, Lyra is our employee assistance program that we've had in place for about 4 or 5 years now. Dr. Joe is a clinical psychologist by training. At Lyra, he oversees Lyra's product suite for supporting workplace mental health. He's also an expert in his field. And I understand that you've been on all kinds of media sources like CNN, Wall Street Journal. I couldn't not say those because I'm like, wow, LA Times, Fast Company. You know, I'm living vicariously through you. But Dr. Joe and his team have been really critical in helping us develop the educational material that we share in the It's Okay campaign every year for the past 4 years. So today we're here to talk about navigating mental health and how the resources that we have, particularly with Lyra. I will tell you that for those on the webcast that in my time here at Cummins, but in all my years of working in employer wellness, EAPs are probably one of the most underutilized resources, and they're so important. So today, what we're really hoping to get out of this is we really want to talk to Michael and hear his story, and then talk to Dr. Joe about how we best utilize resources, in our own journeys. So with that, Michael, I'm going to start with you. Yes, you're not a doctor, but I always want to say you played one on TV, but you didn't actually, so that didn't really work out. But you've been really critical in a large discussion about mental health in Canada and in the US. And so, and you've talked a lot about, you have lived experience, which is probably one of the most critical tools that somebody can offer to somebody else to get through their own journey. So when you think about your internal experience and your external experience helping others, how do you explain your role in mental health?
My role in mental health starts and ends with lived experience, right? I can't treat anyone. I have no expertise in that. But what I do have that I hope Joe doesn't have, because if he has it, that means he's battled mental illness. I hope he has it. But what makes a person like me useful is the description of the lived experience with something like depression and anxiety. Anxiety for me all my life, since I was 5 years old, and depression for the last 20 years. And if we really open up someone like me and we really share to our core, we can engender a reaction in people that sounds like, wow, he's talking about me. Or, wow, somebody else has felt the same things as me. He's not ashamed. He's not embarrassed. He doesn't sound weak. Therefore, I'm empowered to share. So I think there's, clearly there's a role for a guy who's got a PhD in psychology. I mean, obviously. But there's also a role for someone like me in making others feel like they're understood. And I think that word, being understood, is way underrated. I mean, when I go to talks and there's someone in the audience who will come up to me afterwards and often very emotional, and I'll say, like, what's got you so emotional? And the answer is, for the first time, I feel understood.
That's amazing. And I think that, when we do It's Okay, our testimonials are probably our most powerful tool that we have. But before I have a question for you, Dr. Joe, for Michael, when you were with us in the very first session that we did about 1.5 years ago, it was a really moving experience, because I think of that, like, I'm not alone. And so when we talk about mental health, there's a whole range of different experiences, but depression is one that we've talked about with you before. Can you talk a little bit about, because this is a question I think we get a lot, what does depression necessarily feel like? What did it feel like for you?
That is such an important question. It sounds so basic. You wouldn't necessarily ask that question when it comes to a migraine headache. You wouldn't necessarily say to someone, what does that migraine feel like? Because we all understand. What does a cavity feel like? We all understand that. But depression, for example, is something that I've realized when I first experienced it, it was nothing like I thought it was going to be. That I came to the conclusion that you could never understand depression unless you had experienced it. So when you describe what it feels like to you, that can really change somebody else's life. And I've given, 150 speeches. I should have lied. I should have said 500. It would have sounded better. But I always say, okay, I'm going to talk about what depression feels like to me, and you tell me if you haven't experienced the same things. And the first thing I say is the loss of the ability to experience joy. It's not that good things don't happen to you when you have depression. You have the same chances of winning the lottery, but you can't feel it. And that loss of feeling of something like that is devastating. It's one of the reasons why we don't want to get out of bed in the morning, because we know nothing will feel right. And I'll always say to people, hey, raise your hand if that's not you. No one has ever raised their hand. Number two, the loss of self-esteem. For me, that is a crippler. I'm treated, I do well with my depression, but not all the time. And the first thing that goes is my confidence. I'm a guy who I think you probably could tell right now, has a real belief, a commitment to what I'm saying, and a belief in myself. But depression robbed me of that, to the point where I would be looking into the camera hosting a show, and I would be talking like I'm talking right now, and I would hear the sound of my voice, but I would also hear this voice in my head telling me how terrible I was, and how people are laughing at me, and how I didn't deserve to be talking to them, and how it just would destroy me. And again, I asked that question, how many of you have experienced that? And every single person does have an effect on their self-esteem. And the last thing, well, not the last thing I'm going to say, but I would say hopelessness, this terrible feeling. Like 4 days ago, I was walking my dog, and so I don't get too bad. I live my life between a 4 and a 7. So I was having a crappy day, and I thought, wow, I'm going to feel like this the rest of my life. And then it's like, you idiot, you've gone through this 1,000,000 times. How could you make the mistake of believing that this is permanent when you know it's not? So that sense of hopelessness as well.
Well, and thank you for sharing that, because I think there are, I think understanding, I wrote down the words, joy, self-esteem, and hope. And I think those are they're very simple, basic things that someone can look at and say, is this what I'm experiencing? What I want to hear, Michael, and this ties into the question I'm going to ask Dr. Joe about, when you're getting help. But let me ask you one more question. What was the catalyst for you, Michael, that made you say, I have to get help?
Well, I never had a catalyst when it came to my anxiety as a kid, because being a kid, especially, at a different time in our history, but I think it's always going to be difficult. I came from this extremely loving house. My parents would have done anything for me, but I never shared with them that I had terrible anxieties about certain things. And I had something called emetophobia, which, oh my God, in my talk 2 days ago, 5 people in an audience of 400 actually had experienced it. It's a fear of throwing up. It's the fear of being around people who throw up. It's the fear of the thought of it. And that shaped my early life, right? I wouldn't ride on a bus to go to camp and many other things, but I never reached out for help for that. But with depression, I started turning down things that I would never have turned down before. And one time I sat down and thought, okay, why did I say no to that? And this was the catalyst for me. This was the change for me. This may have saved my life, was the recognition that I had changed, that the person I was gone. And the person I had become, I hated and did not want to be. And what I learned on that day that needs to be shared is that mental illness can change us very, very gradually to the point where we don't know we're changing. So I didn't realize that I was a totally different person until this one moment where I started reflecting, forensically evaluating my own life the previous 9 months, and came to the conclusion, I'm really sick. And that's what got me to go, in the hopes that I could be returned to myself.
Feeling like yourself. And so Dr. Joe, this takes me into the question about, Michael's talking about his how he, his journey, what he went through. And yes, getting help, he wanted to go back to who he knew he really was. People often don't know how to take the first step. And can you talk a little bit about, when we talk about EAPs, historically, and I've told this story before, once my husband and I worked for the same company, and we talked about him maybe talking to somebody, which he'd probably kill me if he knew I was saying this on a webcast with my company, but he wouldn't even use his insurance card, right? Because what if the company knew? And in that moment, that's when I realized how bad the stigma was. And in all the work we've done in the past 4 years, I still encounter that. So my question to you is, especially for our employees, can you talk a little bit about EAPs and LYRA, and specifically LYRA has a different model. So when we took, for those on the webcast, LYRA has a different model than a traditional EAP that like we had in the past. And so I think it's important to talk about that model and how EAPs can help.
Yeah, absolutely. And you both teed me up perfectly. So thank you, Michael. I'm so grateful for you telling that kind of personal story. The research supports what you're doing. We know that what really changes hearts and minds about mental health, so that, hopefully, Kate, your husband wouldn't want to kill you if you were sharing something like this, is hearing from people who you admire, you respect, who you relate to, who you feel like can understand your lived experience because they're like you in some way. When you can hear from someone like that, describing not only how they struggled, but how they managed to come out on the other side or find a way to cope and get re-engaged with life again, that's what really makes the difference. And then that's when LYRA is the right option to reach out to. And what makes us different is we're really more like a true mental health benefit. So what I mean is Cummins is very generous in terms of the number of sessions that you get for free every year. It's not just a bucket of sessions for your family, it's a bucket of sessions for you and each of a member of your benefits dependent household. And what that gives you access to is a full spectrum of support. And that's important because, just like Michael was talking about, mental health takes on various shapes and forms. So I might be dealing with relationship stress and striving to communicate better with a loved one, or trying to set goals for myself at work and figure out how to move in that direction. That's mental health, even if it's not a clinical condition. At the same time, I may know someone who's struggling with depression or anxiety, or even something like substance use disorder or PTSD. What that means is that mental health is on a spectrum. We could be anywhere between thriving or in crisis. So we have to have tools and resources to support everyone along that spectrum. So no matter where you are, you have mental health. It really is just a matter of what is your state of mental health. And so at Lyra, we have self-care resources. So maybe you're doing pretty well, you just want to up level a bit. We have guided meditations, we have virtual courses, we have live events like these that are more the self-coping, do-it-yourself approach, using some really effective evidence-based techniques that we teach you. We're essentially teaching you skills. For folks who say, I really want to talk it out with someone, but I'm not dealing with depression or anxiety or a mental illness, I just have goals for myself, or I have areas that I need to improve in. We have a coaching program. And so you can meet live one-on-one with a coach and focus on how to help you meet your goals, how to help you remove barriers that are getting in your way, how to be a more effective communicator, things that can help you, again, kind of up level. And then for those folks who are dealing with the clinical condition, or you're dealing with something that involves other people, I could really benefit from couples therapy, or my family needs therapy. We need a family therapy session, or it's care for my child. That's when the therapy service becomes really valuable. And so again, that's another service that's available on the spectrum. What's important to know about all of these services is you don't have to figure out which one is the best fit for you. The way Lyra is designed, you come to Lyra, you can do that by calling, you can do that by going to our website. You give us a little information about what you're dealing with, and we will recommend the service that we think is right. Now, if you don't agree with us and you say, you think I should do coaching, I think I should do therapy, that's fine too. You get to choose ultimately where you go, and we will recommend providers that we think are a great fit for you based on what you tell us, but you always have the freedom of choice. So I know I've said a lot, but key takeaway, there's something for everyone at Lyra because we all have mental health. We all have the ability to champion our mental health in different ways. And if you don't know what the right support is for you, that's okay. By coming to Lyra, we can help you find the right level of support.
That's awesome. And can you talk a little bit about one of the things that is unique is that Lyra, and I like, is that Lyra is a big proponent of evidence-based therapy, also known as cognitive-based therapy. And when we first launched Lyra, we had a moment, right? And there was some confusion because I feel like at Lyra, the providers are more about quality versus quantity. So talk a little bit. I don't think it's always, I had to go look up what is cognitive behavioral therapy. And so I think for the people listening, it's important to understand why cognitive behavioral therapy is important.
Yeah, kudos to you for doing the research. So cognitive behavioral therapy is simply the most research supported type of therapies. This is kind of eye-opening to think about. There are actually over 500 different types of talk therapies out there that exist. Only about 20% of them have any research to show that they even work. And so what I often tell folks is you would never go to your orthopedic surgeon after let's say you have a break in your leg and say, what do you think is going to be the type of surgery that's going to fix this? And the orthopedic surgeon says, oh, well, this is what I prefer. And I'm just going to kind of fly by the seat of my pants. You would never accept that, right? We take the same approach to mental health. We want our therapists delivering treatments that research shows work. And what makes cognitive behavioral therapy work is that it's goal-oriented, which means you come in and sure, we need to hear your story. We need to hear about what is important to you, what's happening in your life, what your goals are for getting better. But rather than just having you come in every week and, tell us what's on the top of your mind, the therapy is structured. So we get on the same page around what are your goals? To Michael's point from earlier, what would it look like if you got your life back? let's paint the picture. How would you be behaving? How would things be in your relationships? What activities would you be doing? How would you feel, and how would other people know that you felt that way? That helps us get really specific about what it's going to look like to get you better. And then we structure the therapy to help you change ways of thinking and ways of behaving, so we get you to that endpoint goal. And because it's so focused, it helps people to get better faster. And I know we'll probably talk later about what it actually looks like to get people better faster, because that's something we can actually measure. And at Lyra, it's important to us that we're not just, offering access to talk to someone, we're offering access to care that we know is actually going to get people better from whatever it is that brought them to us in the first place.
That's great. I think, I've gone through it at Lyra, so I can attest to the fact that there were a lot of great tools that I said afterwards, I felt like I had done yoga for my mind. It was very calming. So it was a great experience. But Michael, for you, I guess I have two questions really. Like, when you decided to get help, what did that look like for you? What was that, how did you decide to, Dr. Joe's talking about, somebody asking you what would it look like? Sort of, what was that journey for you? And how did you know, like, when did you start to feel better?
What you've just been talking about, I'm quite fascinated by, Joe talking about Lyra and then you talking about Lyra, because I've never used an EAP. I didn't know. I mean, I work at a company, or I worked at a company that is the largest company in Canada focused on mental illness. Bell Media is the name of, and as you said, they did this thing called Bell Let's Talk Day. And I was their mental health spokesperson. And no one ever told me that we had access to an EAP. I had no idea. I didn't know what EAP was. And as I was listening to Joe speaking, I was thinking, that's what someone like me needs. And I don't work for Lyra. I have nothing to gain by saying this, but I can tell you that one of the problems with getting help and starting that is the intimidation of not knowing what to do, where it's like, oh my God, what do I do? You never ask yourself that question when it comes to your heart. You go to your family doctor, and your family doctor would take your blood pressure and a couple of other things. And if you didn't look good, seem good, they would send you to a cardiologist. But this is so different. As Joe said, there's hundreds of different therapies, and then there's all of the medications and all of the one-off treatments. So I didn't have the benefit of that, and I wish I did have the benefit of that. I wish I had someone to hold my hand, because that is everything. And especially when you're battling something like depression, making decisions for yourself, being motivated to get out of bed and to get off the couch, say, is the worst time in your life to have to do something like that. So I think that I think there's a real value in saying, I don't know what to do. And the answer being, you don't have to know what to do, right? Mm-hmm. You don't have to diagnose yourself. Just if you have someone like Lyra that can help you explore where you're at and direct you, then you've got gold that I never had. Yeah. I went on, I started doing talk therapy, and I went on medication. And I was really, really, really sick, to the point where I ended up experiencing it about 4 times. And the last time I experienced it, I was, really worried about where I was at the time. And I remember the moment my wife and I walked into a restaurant, and I was doing what I always do. I would hide when I was depressed, right? I would retreat. I would want to be away from everything and everyone. I wouldn't want to talk to anyone. So I said to Karen, I'm going to go to the washroom, which was in the back of the restaurant. And as I was walking to the back, I remember thinking to myself, wow, I think I feel a bit better. And it was, this is 20 years ago. And still to this day, it makes me incredibly emotional, that feeling of some tiny bit of relief. And that was the first time that I realized how sick I was, because it was like, well, I just got this little bit of relief, and it's like, wow, I feel like my life has changed. So I was lucky. I was lucky that I found the right people after searching for a while, and found relief.
That's I think that it is a journey, and I think some of these are questions I get regular questions from employees, right? About and the questions will also often be, and I'm going to go a little out of order because piggybacking on what Michael just said, Dr. Joe, I'm going to go a little bit out of order because I want to talk about one of the things I want to hear about is how do you find the right provider? Because I hear that from everybody. Yeah, the two biggest questions I get is, well, I don't know how to find the right, what if I don't like my provider? And then the other question is, and even I have said this, I could be thick into drama and I would, and upset, racked by anxiety, and I'll say, well, what am I going to talk about? And so I think it's often finding the right provider and getting the conversation started. But before we go there, based on what Michael just said, how do you measure improvement? So if somebody, I'm skipping ahead a little bit, but you've gone to therapy, you're talking to somebody or coaching or whatever it might be, you're talking about it and you're making an active effort to improve your mental health. How do you start to measure that
Yeah.
it's making a difference?
It's a great question. And I think it goes back to the poignant story that Michael was telling. First of all, it's knowing what is it going to look like and feel like for me when things are better. And that really should be the starting point for therapy, because that sets your goals, right? Like, okay, when you say that you'll feel better, how will you know that you felt better? And what way will you feel better? And what will you be doing more of? And what will your behavior look like? Because then you and the therapist are clued in to the indicators that are going to tell us, are we moving in the right direction? Are the things that we said should be happening if you get better actually happening? So there's kind of a behavioral piece, an emotional piece that we're checking in on. But then there's also an even more objective way of measuring, which is a lot of what we do here at Lyra. We actually will administer a survey. It's a brief survey, but actually research supported. So we know this survey is accurate in measuring symptoms of depression, anxiety, stress. We have other surveys. And it's a way to get you to reflect on, over the past week or two, what does sleep look like for me? Appetite, communication in my relationships, my mood, a whole host of aspects that we know are impacted when our mental health is suffering. And you get a score, and you can essentially measure that score over time. And so our therapists are doing this on at least an every other week basis to quantify, are your symptoms improving? And this does two things. One, it helps you to know whether you're getting better. And what I loved about Michael's story is when people can see that they are getting better, it creates this snowball effect. It gives you hope. It makes you feel like, okay, if I can get this amount better, what else is possible? Let's keep going. It's like your motivation booster. So
Yeah.
It helps you. It also helps your therapist, because your therapist can know treatment is working. And so I need to double down on our treatment plan because it's having the effect, or treatment's not working. Someone's staying the same or getting worse. Got to switch tools, got to switch strategies. And then you get more emphasis on a better treatment plan. And then Lyra gets this data, and what it does for us is it helps us when we pool it all together with all of the patient data. It tells us which providers are getting people better the fastest, which providers are getting people better for which conditions. And that, to kind of foreshadow a future question, is what helps us give really tailored recommendations for providers. Because not only are we making a guess that this person's going to get you better, we actually have a ton of data to tell us this provider gets people with your issues and your background better in this amount of time, so we can feel confident recommending them to you.
That's great. But adding to that, so then when someone says, how do I find the right provider? And I think what I remember when I did Lyra, right, I answered some questions and it gave me some people I could pick from.
Yep.
you know, and I think some of it is, what's the etiquette? Like, if I just don't mesh with this provider, can I pick somebody, you know, can I pick somebody else? And I know what you're going to say to this next question. Like, people will say, well, you know, what do I say? And I think, you know, in my experience, the Lyra providers help guide you, and the questionnaire like that you start with and that you just described is sort of that, that's what gets you started in the direction of what to talk about. So I think you've answered that question, but you know, what's the etiquette if you don't like your provider? Maybe, you know, there's just something, maybe they remind you of the person that you're in therapy for. I don't know. Like,
Yeah,
is the etiquette okay to say, this isn't for me, I'm going to go try this over here?
absolutely. So I should acknowledge in all of this, I also practice on the side as a clinical psychologist. So I see a handful of patients, and I always appreciate when a client tells me, you know, I just think this isn't really a great fit. And we can explore it. If it's not a great fit because they're not getting what they need from me, they're like, I really don't feel like I'm learning skills or getting better. I want to see if I can troubleshoot it with them before we scrap it. But if they're saying, you know what, this isn't really a good fit because I don't know that it's a good personality match. I had a client recently tell me, you know, I just realized that a lot of my issues have to do with my relationship with my father, with my boyfriend, and working with the male therapist just doesn't work for me. I need to work with a female therapist. That's totally fine. You don't have to have a airtight case for why you want to meet with a different provider. It can often be helpful to bring it up to your provider and say, hey, maybe I'm not getting what I need. I could use something different from you. But if that isn't the issue, or you simply feel like that isn't going to be productive for you, you can always just come back to Lyra. And if you figure out that what you're looking for is something a lot more specific or nuanced, and you're not going to get what you want just by going through our website, that's when calling is really helpful, because we have care navigators on the other end of the line whose job it is to take all of your input and all of the idiosyncrasies in what you're looking for and put the human touch on finding the right provider. And you know, the reality is providers are trained for this. We know, oh, someone didn't come back, maybe it wasn't a good fit. That's okay. And ultimately, you getting better through the best fit therapist is the number one goal, and we all understand that, and we always want to help you to find that fit.
Great, thank you. And Michael, my question for you is, and I'm probably interjecting this, but when you were here with us, I think the first time when we were interviewing you, you told a story about the tattoo that you have on your left arm. Is that a story you would share again for us?
Well,
And about your journey?
I would answer that by saying you don't put a tattoo on your arm if you don't want to explain it, right?
That's true. That's a
Imagine,
true statement.
if I went, no, I don't want to talk about it. 11/24/08 YUL MH5210400. That would be November the 24th, 2008. YUL is the Montreal airport code. MH521 is Marriott Hotel Room 521, and 0400 is 4 a.m. in the morning. And that was, for me, one of the real low points in my life. I had battled terrible anxiety. My daughter had health problems, and I was just consumed with fear. And what I found was, when my anxiety is untreated and out of control, I get depressed. So here I was in Montreal, the show that I hosted, Off the Record. We were shooting at the Grey Cup, which would be similar to the Super Bowl. Well, actually not similar. That would be boasting a bit, but it was, so I was in this hotel room, and I'd been through an awful year, and I was sitting there on the edge of my bed, and I was thinking, wow, I understand why people take their own lives. And it wasn't that I didn't love my wife or my kids. It wasn't that I didn't like my job. I didn't have gambling debts. There was no reason why I wanted out, except for the pain that I was in. And the thing that saved me is still, to me, the most important word. And I've noticed you've used it a couple of times, and so has Joe: hope. These illnesses rob us of hope. Show me someone recently diagnosed with depression, and I'll show you someone who feels hopeless. So here I was thinking to myself, I am more afraid to have to go through that day as being me and to fight through it and to pretend like I'm okay. I was way more afraid of that than I was of dying, but I'd been through it before. And I had a little bit of hope that maybe there was, if not a solution for me, a treatment that would help me. And that's what kept me going. And ultimately, I was right. There was something that could help me. But it was at that feeling that I thought, wow, I understand why someone would consider suicide. And it makes no sense until it does. And then when it does, it's like, wow, I never saw this before. So that was, for me, given what I do as a mental health advocate, this I think is the story behind it for sure is important.
Thank you for sharing that again. And, Dr. Joe, I'm going to go out of order. I'm going to get all my questions in. And in fact, there's a question in the Q&A that I'm going to ask. So we will get an answer to that. But that takes me to the question about how to help. So we talk a lot about how to find help for ourselves, but often it is someone around us, right? And we have this question a lot. We do mental health first aider training in some areas of the world, but the concern is always, we try to tell our managers how to identify that someone needs help, but there's a fine line, right? Because we're not clinical psychologists and we shouldn't be giving out the wrong information. So, when you think about Michael's experience and what he went through, there are others like that, and they can't always figure out how to get themselves to the right help. So how do we, as an external person, look to the people around us that we care about and we love and help get them the help that they might need?
Yeah, I'm so glad you asked that question, because there are actually many cases where people become so accustomed to being in a state of pain that it doesn't even register to them that things could be or should be different. It's like a fish, asking the fish, how's the water? And they're like, what's water? It's like, it is just what you live. And so that's why having the outside input of a coworker, a family member, a friend, to say, hey, I've noticed this shift in you and it concerns me and I care about you. That really is the basis for any of these conversations. And what I tell folks is it's really helpful if you can be specific. So when you say like, oh, I noticed that something seems off, that could put someone on the defensive if they don't understand what you mean. Very different than, hey, I've noticed that you typically were up to hang out often. And when you hang out, it seems like you really enjoy what we're doing and you're smiling and you're engaged. And lately I noticed it's hard to get you out of the house. And even when we do, you seem distracted. And that's okay. I just want to understand, how are you doing? And let you know, this is what I'm seeing and it makes me concerned about you. That gives someone some reassurance that they're not being judged. You're expressing your concern from a place of care, that they understand what the sign or symptom is that you're picking up on. And having this open-ended prompt, what's going on for you? How have you been doing? Gives them permission to share as much or as little as they want. And that's really helpful. I always orient people towards 4 categories of signs to pay attention to. You want to pay attention to changes in mood or behavior. If you know someone, chances are you have a good sense of what typical is like for them. If someone is straying away from their typical and how they're showing up and behaving in a way that's concerning, it's worth following up. If someone is talking about a change in their health behaviors, not sleeping, using substances, engaging in some kind of risky behavior, that's worth following up on. If they're mentioning changes in their thinking, gosh, I can't concentrate, I can't pay attention, I can't remember things the way I used to, I feel foggy mentally. Changes in cognition, that's worth following up on. And then to emphasize Michael's story, if you ever hear someone telling you, even in what feels like an offhanded way, like, oh, well, maybe I just won't be around tomorrow, or I feel like I'm at the end of my rope, someone giving you some statement that suggests that they feel a sense of helplessness or hopelessness or despair. Could they be joking? Sure. But always better to treat what could be a joke as serious and follow up and ask them, tell me more about that. What do you mean by that? Versus assuming that they're joking and missing an opportunity to support someone in what could be a life-threatening situation. So those are the 4 signs: following up, letting them know why you're concerned, that you care. And then if they open up and they do share, yeah, I'm struggling, and here's how I'm struggling. If they're a member of your household, you can refer them to Lyra. And that's the easy part here. You can give them the phone number, you can give them the site, you can call on their behalf and give them the phone, step out of the room. It's easy because they'll have their own Lyra benefit and they can use their own group of sessions. If they don't have Lyra, going to a primary care doctor is a great first step. And that primary care doctor can plug them into mental health support through their health insurance plan or through a community resource.
Yeah, and we do on our It's Okay website. I believe we have some resources by region. So I'm going to ask one last question, and then we're going to go to Q&A, which Megan's going to do. But Michael, you have been here with us on multiple occasions and talked about your lived experiences in your journey. Can you just talk a little bit about the value of sharing your experiences? Because I think that is a resource every one of us has in us. That can help somebody else. It's that, yes, you're not alone. And that was the whole point of today, you're not alone. So can you talk a little bit about the value of that resource for you personally?
A couple of days ago, I was, as I said, in Winnipeg giving this talk, and there was, I don't know, 350 people in the audience. And my talk is similar to the sort of the brief spurts of what you've heard from me. And that is, I'm not medical, I'm not clinical. I'm somebody who can describe his own mental illness. And the value of that is that you can provide hope for people, which very often is very difficult to do. You can make people feel understood. And that was the impact that this talk had on me. And the most impactful conversations of my life have been had after giving a talk, when I say, hey, I'm just going to sit down. I'll be there. And if you want to come and talk, come and talk. And that's when people who don't want to put up their hand and ask a question, will really open up. And what I found was, this one woman said to me, I have a son who's battling depression, and hearing your description of how that struggle feels to you was the first time in my life that I felt like I understand. Oh, that's what's going on. And in particular, there was the loss of the ability to experience joy, because the perception of when we care about someone, when we love someone, we don't want them to suffer. So we tend to think that, okay, I'm going to do something nice. I'm going to do something nice for Joe because he's being diagnosed with this mental illness, and I want to make him happy. And the belief that you can make someone happy is not good for the person that believes it or from the person who's struggling. There's nothing wrong with doing something nice for a person with depression. There is something wrong with expecting that to be a treatment for their depression. So I've learned the value of sharing. I've learned how if I share, people will relate to it. And whether it's themselves or someone they care about, it will make a difference.
That's awesome. Thank you again for sharing that. And so we have some, we have some questions that came into the Q&A, and I'm also, Megan, while you're talking about those questions, I'm going to try to answer some of them as well via the written answers.
Yeah, this sounds great. So we got first question is, Michael, what tools or guidance do you suggest to your close friends, family members about how to support you during downswings? How and when do you tell them a downswing is beginning?
I think that in general, the best answer for that is to take a step back and go macro. You need to be honest with the people that care about you, especially with mental illnesses that can't be seen. You can't test for them. There's no depression rash where someone can look at you and say, oh, like, I know that you're like, it's a bad time for you. So they only know what you tell them. And these illnesses, depression and anxiety in particular, make us retreat. So I don't think you can have a successful marriage if you don't share with your partner, or a successful relationship of any kind, because they change us. And if that person doesn't know that you are a different person because of your illness, it's hard to continue to have the same sort of relationship. And what I need to hear more than anything is, okay, I mean, I had this conversation with my wife 3 days ago when I was having a bad day. I said to her, just so you know, I'm having a bad day. And she said, okay, thanks for telling me. And I think she may have added, like, this is a shock. I don't think so. But that paved the way for her to reduce my guilt. Because I can tell you, every person with depression feels guilty that their illness is impacting the people that they care most about in their life, and it's affecting these other people around us. So what I need from her and from other people that care about me is a reduction of my guilt. So saying something like, okay, I understand you're having a bad day. So, feel free to lie on the couch. Feel free to go upstairs if you want and get into bed. Feel free to cancel on this plan or that plan, because the additional burden of feeling guilty just magnifies our illness.
Thank you. Thank you, Michael. That's helpful. I think gives a lot of good perspective into how to communicate, right? Especially during these times. Next question we have is, you brought up family therapy. Does Lyra have child-specific therapy? The question is, I have a 9-year-old and he has anxiety and ADHD. And sometimes as parents, we are not sure how to help him.
Yes, absolutely. We have therapy for children at the age as soon as they're verbal. So you should be able to go on to the Lyra site or call the number and find therapy for your child. You'll just, of course, be answering on their behalf, and we'll be sure to match you with a provider who specializes in treatment for children. And often, just to give you a preview of what that treatment could look like, a lot of times, especially therapy for children of that age range, like around, between 3 and 10, a lot of the therapy revolves around parent coaching too, and doing some coaching to help how to structure your child's day, how to help them with their organization skills, how to help them with cueing and prompting. So we just go into it expecting that as a parent, you'll probably have some homework too. But absolutely, yes, that is part of your benefit. And just important to note, again, your child has their own benefit, their own bucket of sessions. So if you decide that you need therapy or the family needs therapy, the therapy for your child doesn't have to come at the expense of any of those other treatments. He has his own.
That's awesome. You've talked about depression and anxiety. Do your providers ever address low self-esteem?
Absolutely, yes. Low self-esteem, imposter syndrome, self-criticism, self-critical thoughts. Michael was talking about this earlier. Those are all could either be precursors to depression or anxiety, or they could be part of depression or anxiety. And that really is another value of going to talk to a provider. They can do an assessment and essentially interview you in a way that helps them and you to understand the complete picture of what's going on with your mental health. And sometimes folks will realize, I didn't think I was depressed, but turns out these self-critical thoughts or this low self-esteem is part of something bigger. And so I think absolutely our providers can address that, and it is a good reason to consider going to talk to someone.
Yeah, I just want to jump in and say that it's very common if one person has depression, say, and with that depression comes low self-esteem, and there's someone that really cares about that person but doesn't understand it, that the person that wants to help will say, well, I don't know why you're so hard on yourself, or especially if you're in something performance related, it'll be like, oh no, you were great, like, why are you so tough on yourself? And the person who's tough on themselves may not know the reason why. And the reason why is, as Joe said, that can be either the precursor or a symptom of the illnesses we're talking about. And Joe, would you agree with me if I said the way to help someone with their self-esteem is not to tell them, oh my God, like, you're so good at that. It's to treat the illness, because the symptom is part of this illness. And if you don't attack the illness, you're never getting rid of the symptom.
I just want to say, for everyone on this call, I didn't know Michael before we did join this call together, and I feel like we should hit the speaker circuit together, because we're just emphasizing everything I want to say so beautifully. Absolutely correct. And I think when it comes to low self-esteem, just like with the depression, like making someone happy, nice gesture isn't going to cure their depression. Telling someone they did a great job, nice gesture, not going to cure their low self-esteem. It's because those beliefs come from somewhere deeper that your compliment just can't touch. And so the really helpful thing in that situation is just what Michael was saying, and what we were talking about earlier. Let the person know, hey, I've noticed you're often hard on yourself. And I know that I think you do a great job, but that isn't the same as you thinking you do a great job. And I can see that that takes a toll on you. So I'm thinking maybe it'll make sense to talk to a professional who can help, because I would hate to see you struggling with this if you don't have to. That is the kind of conversation that's going to be a lot more productive than just telling someone, you're fabulous, stop worrying. So I love that you make that point.
Beautifully said, both of you. Thank you very much. Next question is kind of describing a journey, but the ultimate is how to navigate through. So someone asking about being diagnosed early on, or at a young age, around in the teens, as with bipolar 1, and then was diagnosed with bipolar 2 later, a little bit later on, a couple years, and then they didn't have bipolar, and now they're back to bipolar. And so can you talk about a little, it seems that maybe there's a couple different ways, but like talking about one, how to ride the journey of mental health, I guess, how to be on that journey, but also how to navigate, and especially then when a mental health struggle comes back, and dealing with that as well. So do you mind talking through that?
Yeah. I think what that highlights is the fact that, unlike a lot of illnesses, mental health isn't always fully cured. It's treated, it's managed, it can go into remission, and there can be a life stressor, a biological change, something that kind of brings it back to the surface. So that's why I think a few things are important. One is, if you have a history of mental illness, it's good to keep and maintain your relationship with a treating provider. So check in every few months or so, even if you think you're doing well, to maintain that connection. And make sure that you have someone who's kind of laying eyes on you from a professional perspective. The other is, if you're dealing with an illness that is more complex, it's taking a bigger toll on your quality of life, this is where it can also be helpful to join a support group and hear from other people who have struggled with these issues, how they're dealing with it, and how they make coping a part of their everyday life, so that you don't have to feel like you're living this life in isolation that no one else understands, of having to battle back with this kind of lifelong recurrent illness. And the other thing I would say is, if you're getting a sense that your symptoms are changing in ways that concern you or others, and your current provider hasn't figured out the treatment that is getting you on the path to recovery again, the second opinion makes a lot of sense. And it's worth reaching out to, if it's psychiatry, maybe your primary care doctor for a different referral. If it's therapy, of course, you could reach out to Lyra. But don't be afraid of getting a second opinion. And also, I encourage people to be really well versed in their own medical history. Don't be afraid to ask for your clinical notes. Don't be afraid to ask for a summary of your chart, so you know exactly what your medical history looks like, and you can bring that to your next provider and get them up to speed.
Thank you. The next question we have, and this is about Lyra and maybe navigating the different providers and different ways to be seen. So says, my other half was terrible at scheduling appointments and has filled out the what am I looking for feeling part of the Lyra website. When he looks for a provider, all he finds are Zoom meetings, and he wants an in-person session even for the first one. So he's kind of given up on scheduling anything with Lyra, but he has asked me to help him schedule or reschedule some other appointments. So how can I help him with this one?
Great question. We always want to make sure people have a choice. So there should be in-person providers available. When you go through Lyra, you should be able to check a preference for in-person providers, and it should show you providers in person if you check that box. If for some reason it doesn't, that's when calling the toll-free number is helpful. And I would just reassure your partner that that doesn't need to be a long, lengthy call. Like, there aren't long wait times to get a hold of someone when they call Lyra. They can call 24/7. They could call at any time of day or night, and that person can help guide them to finding an in-person provider in the odd experience that they wouldn't be seeing them on the website. But if maybe it's helpful, you could go through the triage process with them on the website and look for the box near the end of the form where it asks you what your preference is, in person or not, and make sure they have that checked. But always call when in doubt.
Perfect. Thank you. We've got 2 questions left and about 2 minutes left. I know this has been super helpful, and we've got lots of great questions. So I think Dr. Joe, you talked about this a little bit, but it says, does mental health need lifetime medical treatment, or can you stop after therapy or stop after recovery? Excuse me.
There are many people who fully recover from a mental illness, and that's it for them. They move on with their life. And that's the reason why evidence-based therapies like cognitive behavioral therapy are so valuable, because they teach you skills. And it's you being able to rely on those skills that's going to help you essentially stay in that recovery mode from here on out. And then there are certain conditions that just need to be managed over time. So I think what's important there is to recognize mental health, mental illness, not one thing. We can't paint it in a broad brushstroke, but for many people, recovery is absolutely possible. And even if you're struggling in a way with a condition that you'll have to deal with over your life, just know you can still recover from your illness, even if it may come back in some later point. The fact that you have recovered in the past is going to make it more likely that you'll recover again if it comes back up in the future. And you'll know the steps to do it because you will have gotten care from a provider who helped you.
Perfect. Thank you. Okay. Last question. Oh, Kate, do you want to wrap
No,
up?
no,
We have time.
go ahead.
So, it says, can you give advice about bullying and the adverse effects? My son is being bullied and is causing low self-esteem. So can you talk a little bit, maybe what are next steps for this person?
Yeah, gosh, let me just validate that is a really, really hard situation for you and for your son. Therapy can be helpful, talking about ways of coping, making sure this isn't causing depression or impacting lifelong self-esteem. Of course, talking with the school. There are a lot of skills that we can use to train children how to navigate bullying, but often there needs to be a school intervention to break that pattern with the offending bullies. And Michael, I'm curious if you have any thoughts here. I'm not a parent, and this is where I always know I should defer to folks who are parents.
Yeah, it's incredibly difficult. I mean, being a parent is incredibly difficult. The first moment that you find out that there's something that your kid is sick, whether it's physical illness or mental illness, is like a totally different adventure in your life. And the fact that your son is being bullied, I'm sure, is keeping you up at night. And I don't have an expertise in that area, but I do have an expertise in understanding what other parents might feel. And being proactive is everything, because if he is getting help and it's not helping, then you got to change the help, and that change in help all of a sudden is hope, right? I mean, he's not in a position that can't be fixed, but it won't be fixed unless you try to fix it. It's like the only wrong course of treatment, the only wrong course is no course change at all. So that's kind of the limit of my pay grade when it comes to dealing with something like that.
Well, thank you both. And I know we ran out of time and we had a lot of good discussion. And I really thank both of you, for Michael, for all of the support that you have given us, and all of the shared experiences have been really We've gotten such good feedback about it. And Dr. Joe, thank you for you and your team for all of the just the ongoing support in helping us build the campaign and continue with it with interesting and meaningful content. So thank you both. And I think
My
with
pleasure.
what-
I have to say this, watch in your local city for the Joe and Michael tour.
Oh, yes.
You heard it here first, folks.
Yeah. I like to refer to it as, I'm not a doctor, but my brother is tour. Yes.
Well, thank you guys very much. Megan, is there anything else in closing that I'm forgetting?
Nope, that's all. Everyone, and no, mentalhealth.cummins.com, cummins.lyrahealth.com. Use those resources. Reach out if you have questions.
Thank you.
So much.
Have a good day.
Appreciate it.
Bye-bye.
Take care.
Bye.